So the topic of today's discussion is a fifth chapter from the Kent's philosophy, which is discrimination as to maintaining external causes and surgical diseases. Okay. So let us first understand the meaning of discrimination and in what sense has Master Kent used this word. Okay. We wish to revert for a short time to the fourth paragraph in which Hahnemann says, the physician is likewise a preserver of health if he knows the things that derange health and cause disease, and how to remove them from persons in health. So let us understand further. The homeopathic physician is a failure if he does not discriminate. So it is very important for a homeopathic physician to have the quality of discrimination. Okay, but in what sense? Let us see further. Persons about to be made sick from bad habits should break off their bad habits. They should move from damp houses. They should plug their sewers or have traps put in if they are being poisoned with sewer gas. So whatever are the surroundings, if there are bad surroundings, or if they are living in a place which is very unhygienic or unhealthy, so they should remove themselves from such places, and it is important for the physician to note these things and to guide your patients to do so. It is everybody's duty to do these things, but especially the physicians, and we must almost let it go with the saying, to prevent coffee drinking, vinegar drinking, etc. is a superficial thing, but in this way he may preserve health. So even these tiny little things which the physician directs to the patient, it is very important. These things are also very, very important. To discriminate then is the most important thing. So in this context, Master Kent says that it is the most important thing to discriminate. One who is sick in his vital force needs a physician. So we need to understand and analyze and to discriminate what the patient needs. So if the patient needs a physician, one who is sick in his vital force, he would need a physician. He who has a lacerated wound or a broken bone or deformities has need of a surgeon. If his tooth must come out, he should see a dentist. Okay, so we should know what, as a physician, we should know that how are we supposed to analyze what the patient is in need of. What is the physician's duty? It is folly to give medicine for a lacerated wound, to attempt to close up a deep wound with a dose of remedy. So this would be illogical if you are trying to treat a lacerated wound, a deep-seated wound, only with giving a remedy, because that is not going to really help the patient. Injuries from knives, hooks, etc. must be attended by the surgeon. If the physician acts also as a surgeon, he must know when he is to perform his functions as a surgeon. So where does a physician's role come? So you should know when is your role going to come and when he must keep back as a surgeon. The physician must know the things that derange health and remove them. So what is our duty as the physician? To know things that are deranging the health, and we should be able to remove these causes. When signs and symptoms are present, the physician is needed because these come from the interior to the exterior. Okay, so when is our need there? When there is derangement of the vital force, which is the interior economy, and when the disorder is from interior to exterior, then the physician's role is going to be the most important one. Okay, but if his condition is brought on only from external causes, the physician must delay action. So if the causes are external, then we should wait. As the physician, it is our duty to delay our action or to wait and let the surgeon do his work. Sora corresponds to a state of man in which he has so disordered his economy to the very uttermost that he becomes susceptible to every surrounding influence. It is the man's economy that has been disordered, and because of this disordered economy, what Dr. Hanneman is trying to tell us that first of all, the idea of Sora comes with a man being disordered primarily, yeah, so that he becomes susceptible to every surrounding influence that he is having in the surrounding him. So so if a man is evil in his very interior, that is in his will and understanding, if his will and understanding is spoiled in some way or has gone haywire or gone disordered, then what would happen is that the result of this evil flows into his life. Now this evil will and understand which he has imbibed in his in himself, so this evil thing will flow into his life and he is in a state of disorder. This is what Hahnemann's idea of Sora is. Interior of man forms the exterior. Now this is very important for us to understand. Okay, let man exist for thousands of years thinking false theories and bringing them into his life will become one of the disorder. If he keeps on having some false theories in his mind, what would happen is that there would be a disordered economy which he is into himself. So later we will be able to show that this disordered condition of the economy is the underlying fundamental state of the nature of Sora. So what Hahnemann is trying to tell us that this disordered condition which is there in a human being, this is the fundamental state or nature of the Sora, which ultimates upon the body in tissue changes. And how does Sora show itself? It shows in the form of tissue changes, which is only a result of disease, right? But not the disease itself. So, an example Master Kent gives us, that is, suppose a man starts out and believes that it is right for him to live upon a certain kind of food that is very distasteful to him. Now, this is just an idea which a man is having, that it is okay to live a life eating a distasteful food, okay? Then further, he lives upon that diet until he thinks from his belief that he really loves it. Now he starts believing this, that this distasteful food that he is having, he started to love it, okay? And in time, his very outermost becomes as morbid as he is himself. Now what would happen gradually is that this disorder will not only manifest from inside, but then gradually it will start showing on the exterior body as well. When man is insane in his interior, that is in his body inside, okay, when the man is insane in his interior, it is only a question of time and his body will take on the results of insanity. The results of insanity which was there inside of his body, the result will also be shown outside, because the interior of man forms the exterior. Whatever disorder will be there inside in the interior will also be shown in the exterior body. So then let us understand causes. Okay, each and everything that happens before the eyes is but a representative of its cause. Okay, whatever you see, if you see some eruptions which are coming on the skin, if there's an ulcer which is there, or any result of the disease, so what Master Kent is telling us that these are only representatives of the cause, and there is no cause except in the interior. Okay, so cause does not flow from the outermost of man to the interior because man is protected against such a state of affairs. There is no disease that exists of which the cause is known to man by the eye or by microscope. We cannot tell that, if we are seeing certain kind of bacteria or viruses in the microscope, these are not the actual causes of disease, but the cause lies deeper within in the disordered vital force. Then causes are infinitely too fine to be observed by any instrument of precision. So Kent is telling that it is not merely these microbes or these pathological results that we are seeing under microscope that are causes, but the cause is deep within or in the interior of the man. They are so immaterial that they correspond to and operate upon the interior nature of man. Now, these miasms which are there inside, they are immaterial causes. Okay, you cannot, materialize them or see it under the microscope. But he tells that these are the they are ultimated in the body in the form of tissue changes that are recognized by the eye. Now these are only the ultimates or the results which are seen in the form of tissue changes or in the form of pathological changes. So here a diagrammatic representation is given, that is these are the immaterial causes which we cannot see with the naked eye and which are present in the interior of the human organism, and they are miasms which show their results in the form of tissue changes, and this is only the result of the disease. Such tissue changes must be understood as a result of disease only, or the physician will never perceive what disease cause is. So, we should first primarily understand the simple thing is that this is only the result of the disease. Okay. Otherwise, we will never be able to understand what is the real cause of the disease or what potentization is or what is the nature of life. So this is what Hahnemann meant when he speaks of the fundamental causes as existing in chronic miasms. Just as soon as man lives a disorderly life, he is susceptible to outside influences, and the more disorderly he lives, the more susceptible he becomes to the atmosphere he lives in. If a human being keeps on drinking alcohol, keeps on living a sedentary life, keeps on having a diet which is not an appropriate diet, okay, if uh, he keeps on doing these things and living his life in a very disordered manner, what will happen is that he will uh, you know he will be his vital force will be deranged in a span of time, and he will become susceptible to outside influences. Whatever influences are there outside, he will become very susceptible to those, and if he continues to do that, then again he will invite more diseases. So man living disorderly life, having deranged mental state, for example, if with living a disordered life and he also has a deranged mental state, okay, what would happen is that he would become susceptible to outside influences, and the more susceptible he becomes, then he would also become susceptible to the environment he is living in. For example, if he is exposed to a person, if he is exposed to um, rains, okay, so not everybody who is getting drenched in rain will catch a fever or cold or things like that, but the primary thing is that he would be living a disordered life which has caused him to become more susceptible to the environment that he is living in. So when man thinks in a disorderly way, so when the thinking his mental state is in a disorderly way, he carries out his life in a disorderly way. So when the problem is here, uh, the way he lives his life will also be in a disordered manner, and makes himself sick by disorderly habits of thinking and living. And thus what will happen is that he will not only start imbibing such wrong habits, but also uh, in his he will also think in a disorderly way, and he would also be living in a disorderly way for him to be susceptible to diseases. So this deranged mental state Hahnemann most certainly recognizes. What Master Hahnemann does is that he primarily uh, what you call recognizes this deranged mental state, for he tells us everywhere in his teaching to pay most attention to the mental state. That is why Master Hahnemann tells that you should be very careful and in paying attention to the mental state of the patient. We must begin with such signs as represent to the mind. So the signs which are representing the mind, the symptoms which are representing the mind, you should be very careful in picking those. The beginning, that is the beginning of the sickness, and this beginning will be found in the mental disorder as represented by signs and symptoms. And as it flows on, we have the coarser manifestations of the disease. So when you would see that when the disorder is there in the mental state, okay, then gradually you will also be able to see the coarser manifestations of the disease, meaning that the manifestations which you can see in the form of signs and symptoms, or you can see it with the naked eye, the signs and symptoms which you get. The more mental it is, the more signs there are to direct the physician to the remedy. You know, when you get the essence of the drug, or the pronounced mental picture in a patient, then the physician is more directed towards the remedy which will cure the patient eventually. In these investigations, the ascertainable physical constitutions of the patients are to be taken into consideration. So these are the things which a physician must consider. Okay, Kent says you have to consider both the internal and external man. It is not only the mental state that you have to consider. It is very important, but you have to also take into consideration the mental picture, and also the outwardly sign and symptoms which the patient is presenting to you. So further he says, that is, you have to consider causes that operate in this disordered innermost, the innermost disorder that has occurred in a sick person. Those causes also you should be able to pick. And then the ultimates. Ultimate means the result of the disease which you can see with your eye, which constitute the outward appearance, particularly when the affection is chronic. So he says this is particularly you. This is the most important thing, especially when the disease or the affection is chronic. So we need to consider both the internal and the external man. So again, these two things must be considered, that is the nature or essence of the disease and its appearance. So now at the present day, let's see what is the idea present day. Diseases are named in the books from their appearance, do not have reference to the sick man but to the ultimates. Now you name any disease, okay, be it from be it from eczema, or it's psoriasis, or it's rheumatism, or it is gout, or any disease you name. uh, these are only ultimates or the results of the disease, and they do not refer itself to the sick man. If the disease has terminated in the liver, numerous names are applied to the liver. For example, you name any liver disease, if it is psoriasis, or if there's any cyst that is present in the liver, or you know any disease that you would name, which where the manifestation is shown in the liver, or if it is in the kidney, or if it is in the heart. These organs have names applied to them, and such terminations are called diseases. So, in the books, what they call as diseases, is that these are only the ultimates, but not the disease itself. The susceptibility remains the same, and only those that are susceptible will take the diseases. So this is the basic idea which we homeopaths we need to uh, consider, that is only a person who is susceptible to the disease will be affected by these diseases. Okay. The study of disease as to fundamental cause and apparent cause is an important subject. This is very important for homeopaths to understand. Okay, the fundamental cause and the apparent cause. We cannot study cause unless we have first understood the government associated with the law. Hence, recall to your mind that the law directs and experience confirms. So, what we need to understand is that the laws which are there in our pathy, they are going to direct us towards the towards understanding these causes. And as you all grow in your practice and you gain experience, then this law will be confirmed. Okay, you will see it being confirmed with your experience. Law is nothing but an orderly state of government which is from center to circumference, a government in which there is a head. So, who is the head in us? That is the vital force. So, this vital force is going to govern the entire body, and when it is in health, it will harmoniously do all the necessary functions in the body. So, this is the head. Then order exists from the highest to the lowest, from center to circumference. Let us, as homeopaths, turn our lives, our thinking abilities, and our scientific life into order, that we may begin to turn the human race in order. So, this is the most important lines which Master Kent has told, that as homeopaths, what we should do is that this disordered economy, which is resulting into silent symptoms, and you know showing that a person is deceased, this disorder we need to bring into order again, and that is how a person will be again brought back to health, after of course giving the simillimum to the patient. So that is it for today.